Good afternoon, everyone, and welcome to the first talk of our Spring 2026 Climate and Health Learning Series. We have a really exciting spring series planned out for you guys, and we're kicking off with two great lectures today. I'm just going to give you a quick overview of the rest of our spring series, and then I'll introduce our two speakers from today. I also want to remind folks to put questions in the Q&A chat, where I will be moderating an after discussion when the presentation is over. And also remind everyone to fill out the post-session survey so we can know how to tailor these talks more adequately to your desires. But today we're going to be talking about brain health and climate change. And in February, Dr. Matt Burgess will be speaking about economic impacts and how that's impacting climate and health. In March, we'll have two infectious disease physicians, Dr. Preeti Jaggi and Shreya Doshi, talking about infection prevention and impacts on climate and health. In April, Dr. Leo Trissan will be talking about plastics and health. That will be an in-person event somewhere in Idaho. We haven't decided exactly where yet, but be tuned for location details coming. And then we'll conclude in May with Dr. Mathilde Gaudreau-Simard, who will be talking about the Choosing Wisely guidelines that one of our recent speakers, Dr. Hardeep Singh, talked about in terms of a way to better tailor your care to a climate-friendly way. So today we've got two neurologists speaking with us about neurologic impacts on climate health. They're going to be mixing and matching, so I'm just going to introduce them both now. Dr. Bret Andrews is the former Associate Chief of Neurology at Kaiser Permanente in Oakland and currently works part-time there. He focuses primarily on advocacy for climate health policy and building electrification, presenting to physicians, policy leaders, and communities. He's a co-director of NICHE, one of the best acronymed climate health organizations, neurologist interested in climate and health, and a board member of the San Francisco Bay Physicians for Social Responsibility. Dr. Beth Malow will also be speaking. She is the Burry Chair of Cognitive Childhood Development and Professor of Neurology and Pediatrics at Vanderbilt University Medical Center. Dr. Mallow's clinical interests and research interests focus on improving health and quality of life for individuals with intellectual and developmental disabilities across their lifespan. She's also a strong advocate for a healthier climate and enjoys speaking about the impact of climate change on brain health and what we can do to influence legislatures and the public. Dr. Malow has published more than 140 peer-reviewed articles along with books, chapters of books, and review articles with foundation industry and federally funding of her work. So without further ado, I'll let Dr. Malow take things away.
Wonderful. And I'm so happy to be here with Bret. And thank you, Bret, for putting up the slides. I'll go ahead and get us started, and then we'll go back and forth a bit. And I'm going to start with a story because I do enjoy communicating to the public and advocacy. And it's really timely, actually, because right before I came on this webinar, I was out cross-country skiing in my backyard, and well, not my backyard. There's a lake near where I live in Vermont. I work for Vanderbilt Medical Center remotely, and I'm just really fortunate to do that. I live in Vermont. I see kids and adults who sleep on telehealth, and I love being in the outdoors. And you can see on the left here, I'm here with my husband in this photo, and this is exactly what it was like a few minutes ago when I was out cross-country skiing. And we had white fluffy snow. We had about 5 inches over the last few days. It was just absolutely gorgeous. The trees, everything was so beautiful. And when I talk to my friends, colleagues, and patients, that's what I share with them, that I love the snow, I love the outdoors. And it's very sad when you see the image on the right, which was from last year, when the snow was drying up and we just didn't have a whole lot of snow. And that impacted me, not just because I like to get out in it, but because my mental health is so linked to being out in the world and being outside. It's also linked to the economy in Vermont and other New England states that we really rely on tourism and skiing and all of that. So this is part of global warming and a changing climate. And we'll come back to this later after we review aspects of climate change and brain health, to talk more about what we can do. How do we connect with our friends, our colleagues, our patients, and communicate these simple messages. And Bret will also have a little story to share of his own in a bit. Okay, next slide. So my task to get us started is I want to just give you a little bit of background on climate change and global warming. You may already have this from previous lectures in your series, but I'll just take just a few minutes to make sure that we're all on the same page, because it's very common these days. It's very complex, let me just say that, climate change. So when we try to talk with patients, friends, colleagues, they may not always understand, or they may have read something in the news that isn't correct. So just having these facts in our back pocket has really helped me. Okay, so warming is clearly accelerating. Every year is the warmest year ever until the next year, which then becomes the warmest year. We've seen this increase since the 1940s. I mean, actually before them potentially, but since we've really been keeping records from this one source, Copernicus, and 2020 and 2021, and each year afterward, we've been having very warm temperatures, which are about 1.5 Celsius above pre-industrial levels, and that's globally. And then we also see a rise in CO2, global CO2. And this is really important because this is where we get the heat trapping. It's the CO2 in our atmosphere that traps heat, resulting in the warmer temperatures, and it's the main driver of climate change. Next slide. Now, this is something that I really talk about when I want to explain to my colleagues and friends and others what's going on with climate change. And I talk about this idea that we've had these cycles throughout history, because people will oftentimes say, well, isn't it true that there's been cold cycles and warm cycles, and aren't we just in a cycle? And I say, you're absolutely right about the cycles. They go back, I mean, here it's going back 800,000 years. However, if you look at the right side of this graph, we're plotting CO2 parts per million versus time. And if you look at the 20th century, the 1900s, we saw this unprecedented rise in CO2 parts per million, which traps which is responsible for the global warming and the climate change, the trapping of the heat. And you can see here that we've left the cycle. Like we're clearly out of the realm of these cycles. So this can be extremely convincing to people when I show it. The next question I usually get is, how do you know what happened 800,000 years ago? And the way we explain that is with these ice core samples that scientists go to the poles of the Earth, they drill the ice, they get these long cylinders, and just like rock and sediment help us, let's say, date fossils over thousands of years, you can do the same thing with ice. And looking at the trapped air bubbles, you can get a representation of the atmosphere's composition at whatever point in time you're at. Next slide. So as a result of these changes in climate and global warming, we are seeing devastation. We're seeing, for example, flooding and hurricanes. And this is just one example from North Carolina last year. I mean, we're not just seeing the devastating impact on the towns and the populations, but we're seeing the economic impact of more than 55 billion in damages from just Helene and Milton alone, and the killing by the flooding. I mean, it's extremely devastating, and then displacements and disruptions and stress. Next slide. And then also the wildfires. And Here we're seeing wildfires on the left from the Amazon in South America, and we're also seeing this was Sydney, Australia in the middle, and then on the right is the LA wildfires. And what's happening here is it's kind of like a vicious circle. You have your wildfires fueled by hotter temperatures, but then you also have wildfire smoke that is really quite devastating, because what happens when you have the hotter temperatures is you have more dryness, you have more evaporation of moisture from soil and vegetation, drying out of trees and shrubs and grass, so you can set yourself up for wildfires. And you'll hear from Bret in a few minutes about what PM 2.5 is all about. But the wildfire smoke is the most toxic cause of this particulate matter that's been implicated in health, particularly in brain health. Next slide. So I'll just talk about a couple of areas, and then Bret will get into more areas of brain health. I'm just going to talk about sleep and autism. So in sleep, we now have some really well done papers. This first paper was from Nature by Lee last year, and it looked at 23 million days from more than 200,000 participants across mainland China. And basically, for every 10 degrees centigrade or increase in temperature, the total sleep duration in the population decreased by 10 minutes. And 10 minutes doesn't sound like a lot, but it adds up over time and contributes to sleep deprivation. This 10 minutes a night. And then obstructive sleep apnea is the other area where you can have worsening by global warming and increased temperature. And it's felt to be due to an increase in heat-related inflammation, leading to airway narrowing, increased nasal congestion, and night wakings. And then globally, these higher temperatures, when you compared 99th percentile with 25th, were associated with a higher probability of apnea. And again, thinking about economics, where we're seeing a loss, not just in health life years, but in the US dollars, 30 billion US dollars. Next slide. And then next slide, Brett, thanks. In autism, this is just one case control study. My mentor, when I was doing my electronic health research, was Lisa Crowan from California, and she was an author on this, looking at particulate exposure in the first year of life in kids with autism compared to controls, and showing that the odds ratio of having the exposure was higher in the autism group, implicating that there at least is an association between particulate exposure and autism. This was controlled for factors such as maternal age, education, race, ethnicity, smoking, and month and year of birth. And I just want to mention that if you go to the next slide, this is just one study. And I'm sorry, Ethan is writing in the chat, Tylenol use. No, they didn't look, I don't think, at Tylenol use, but maybe they should have. I don't know. I actually want to say something about that, and then I'll get to this slide, which is a lot of people are looking for environmental causes, right, of autism, in addition to the very strong genetic predisposition. It's felt to maybe be a two-hit, where you have genetic predisposition and then you have environmental. And I do truly believe environmental plays a major role in autism. It's just not what people think. It's not that, the vaccines have been debunked. Now Tylenol is getting a lot of attention, but there have been very good studies showing that Tylenol does not appear to be a factor in the causation of autism when you adjust for example, genetics. But what very well may be causal in autism or contributory in autism is air pollution. And this is just to show that in addition to the study I just showed, there have been 4 systematic reviews recently with meta-analyses, all supporting that particulate matter, air pollution contributes to autism, and 1 Mendelian randomization study. Okay, I think we're going to shift things now to Bret, and then I'll come back a little bit later to talk about communication.
Thanks so much, Beth. It's a pleasure to present to you. Just like Beth, I think it's very important in our going forward with this subject to be communicating. And notice that Beth told her story, and I'm going to tell my story. And what we're doing is communicating the social and emotional level, which is by research, the most effective way to reach people. We have to bridge those divides and communicate with people with some common language. And so my story may be similar to some of you who live in the mountains. Climate change, I've been seeing it more when I go to the mountains, and I've gone to the mountains since I was a kid. I used to live in Los Angeles. I've lived in urban areas most of my life, but in the summers, I would go to the mountains, and the glaciers have been receding. Things have been changing, and you might call this solastalgia, which is the feeling that the environment is changing, but there's no control that we really have over that. That's the feeling I was having for many years. We could see the dying of trees and the loss of insects and animals in the mountains, and just a creep of change with the dryness and other factors. But of course, the major one, which I experienced directly several times, this is the first time, and it was the most emotionally wrenching time for me, was I was backpacking in 2013, and there was a massive fire that started on the western side of Yosemite. I was 10 to 20 miles away, very safe from the direct effect, but the sky grew dark, the ash started falling, and it felt like apocalypse. So that brought me from an awareness of climate change and a concern to, we have to do something about this. So that brought me to seek out how to understand the health effects and benefits better, and how to seek to advocate for climate health. And so now I do a lot of that, and I've had that opportunity partially by shifting to being only partially employed. So communication is the key. And I'm going to now shift to talking a little bit more about the technical stuff. But for us to influence policymakers and the public, we don't need to give a bunch of numbers. We need to talk about what we have in common of our concern for health and our concern for the economics going forward that are consequences of this crisis. So climate change and air pollution are related. People may debate whether greenhouse gases are air pollutants, but the fact is both are changing the climate through the direct effect of greenhouse gases. We are feeling, I should say indirect, in that it's changing the heat and then affecting health. We have neurologic consequences, and also from the direct toxic effect. And those are much more immediate, and they have a much higher health effect on us now. Of course, if someone goes through a climate disaster, that's a major health effect. But for all of us, we're experiencing the wildfires and other direct toxic exposure. So we're talking about particulate matter. That's the PM 2.5 and 10 stuff. That's basically soot. And what it has in it may have a lot to do with how much it's toxic. Wildfire smoke, if it burns a town with plastic, metals, and all sorts of human-made stuff, may be much more toxic than that from burning just trees and grasses. As well, we have various gases. We have nitrogen dioxide, we have volatile organic chemicals, and other things that are volatilized from partial combustion. And all of these are affecting what we're breathing. And the mechanisms are not fully understood, but we are now understanding better that there's probably both inflammation effects at the level of the lungs in the alveoli and some of the smallest particles, because PM 2.5 is quite small, and some of PM 2.5, the ultrafine particles, are much smaller than the larger versions of PM 2.5. Those small ones are crossing the lung membrane, just like we talk about nanoplastics, the smallest plastics. We're seeing those in end organs, in the brain, in vessels, and so forth. And we're seeing that with the combustants from fossil fuels. And the direct effects are just starting to be better understood. We have a lot of association data, and I'll talk a little bit more about that, but clearly the air pollution factor has a profound effect now on health. And the outdoor component of this is probably causing premature deaths in over 100,000 people in the US and estimates of 4.2 million worldwide. And when you include indoor air, we're talking about 7 million premature deaths. And that's as much as the COVID-19 total deaths and more than diabetes kills annually. And at about half of that is cardiovascular, which would be stroke and heart disease. So a major component of this is those. The World Health Organization estimates that levels of unhealthy air are at about 99% of air that people are breathing. And there are no safe levels that we know of on the lower end of that exposure. So you probably are aware of the air quality index. Some people track it quite a bit with purple air or other means. It's often announced in the news. And that's a short-term measure of the concentration of PM 2.5. There are other air quality indexes for nitrogen dioxide and others, but we mostly talk about the PM 2.5 index, and we don't even say PM 2.5. This was given some estimates by the EPA of safe levels, but these numbers aren't proved out by the data. There's actually associations with stroke and dementia and Parkinson's at levels lower than 50. These are short-term exposures when we talk about the air quality index, but over time, these exposures can be cumulative. So we have estimates now that the burden of stroke worldwide is increased by 14 to 20% by air pollution. And this is by the Global Burden of Disease through the Lancet group. The World Stroke Organization acknowledged this. And let's look at a couple papers. There's lots of research that's been done over decades relating to cardiovascular disease and PM 2.5. A recent meta-analysis, for example, said that a 10 microgram increase, and just to clarify, 10 micrograms is like going from 0 to 50 on the air quality index. But when you're in the middle of that graph, it's a different, just about going about 20. So 50 to 69, for example, would be a typical increase of 10 micrograms. The stroke risk is going up by 13%. As well, heart disease risks are going up proportionately. And if you look at short-term exposures, this paper showed for the less than or equal to 5-day exposures, 110 studies. Nitrogen dioxide topped the list. PM 2.5 and PM 10 are also on there. PM 10 is the larger than 2.5 micrograms. And 2.5 micrograms is like a 30th of a human hair, or close to the size of a red blood cell, which is 7 micrometers. So 2.5 micrometers And if I'm saying micrograms, I mean micrometers, sorry. Um, and 10 micrometers is larger particulate matter. So also stroke by proximity, just being near sources of pollution. This study took population from Manhattan of over 3,000 patients. Those living less than 100 meters versus greater than 400, 42% higher risk of ischemic stroke. So this leads to identifying air pollution and particulate matter as being risk factors for stroke and modifiable risk factors for stroke potentially, right? So outdoor air pollution accounts for 17% of stroke disability worldwide. And we've had the luxury of the Clean Air Act for several decades now that's dropped a lot of these pollutants down in levels, but still that narrowing could be lost by things like wildfire pollution, which are increasing in a big way from Canada, for example, and from the United States. In a dementia risk, a recent meta-analysis of 20 cohort studies for long-term exposure, an increment of 1 microgram, that's like going from an air quality index from 50 to 53, for PM 2.5 caused a 3% increase in dementia risk. And another study on traffic, 13% higher risk for those living less than versus greater than a kilometer from a major roadway. And there's been other meta-analyses. Here's a citing of multiple papers where the red characters mean that there's a positive, a significant result for pollutants. And the pollutants that were most associated through many of these papers is PM 2.5, more than nitrogen dioxide in traffic and more than the others. And so dementia is also a modifiable risk factor identified by the Lancet Group and others. And they upgraded it to 3% last year of the 45% of modifiable risk factors. The dementia, air pollution contributes 3%. So Parkinson's disease is a little bit newer on the block. There's not been as many studies, but here are some significant studies, for example, implicating Parkinson's disease association. 56% greater with a Medicare population exposed to a median level of pollution. That's an air quality index equivalent of 40, like 7 micrograms per cubic meter, versus those in very low areas of the United States in terms of PM 2.5 exposure, 56% greater risk of Parkinson's diagnosis. And a study in China linked even a short-term exposure of PM 2.5, PM 10, and nitrogen dioxide with Parkinson's disease. This is a study that came out this year. And they said the nitrogen dioxide increments increased Parkinson's by 4.67%. So we're not just talking about PM 2.5. Here's nitrogen dioxide as another toxicant. So a lot of people, I believe, on this call are in or near Idaho or in the Rocky Mountains region. A paper that came out this year identified a 10 times increase in extent, that's the amount of acres, and 15 times severity since the 1980s in wildfires. And it's expected to increase 3 times and 4 times extent and severity by 2050 on this same trajectory. And that's like taking the worst of your wildfire seasons and starting to normalize those. This is a very severe problem, and Canada is even having a bigger problem with this. So the causes are not so simple, but climate change and drought are a major factor, clearly, because they can track and see drier seasons and longer fire seasons where fires are occurring earlier than before. We also things like wind patterns, the history of fire suppression policy, human habitation, and pine beetles are other factors to discuss. But we're seeing this worldwide, as Beth referred to, tropical areas and increases in the tundra and taiga regions closer to the poles where we're having just massive burdens from wildfire smoke. And this is becoming a major emerging increase in our direct toxic risk. Let's talk just a little bit about the data we have so far. It's a little harder to connect the dots for the research to isolate the effect of wildfire smoke. And so there are less studies, and the studies are not quite as robust in the association, but there was a study out this year that showed that when they associate the amount of mortality that we are seeing probably from wildfire smoke, it is significantly increasing in the U.S. and worldwide. Over the last 11 years, they looked at mortality, increased or excess mortality estimates, and they're rating it at about 41,000 per year in the U.S. now. And most of those are people over 65. By 2050, they're estimating that this could increase by 64 to 73% under current trajectories. Also, there was a previous study in 2021 that estimated when you look at all causes of death, premature death, wildfire PM 2.5 smoke was associated with 0.5% of those for all-cause wildfire. And then they were able to say cardiovascular was 0.67 of all-cause wildfire PM 2.5 is 0.67 of all-cause deaths. So there is a significant mortality association. When we're talking about stroke, the data has been a little more mixed. There was a study that came out this year, the Alexa Kaiser study, which only showed some of the air basins linking cardiovascular to increases in PM 2.5 from wildfire smoke. But there was a study in 2015 that looked at California air basins, and they did see an association or relative risk of 1.22 for cerebrovascular. So we're directly talking about stroke now and cerebrovascular events with dense smoke. And these are mostly populations over 65. There was a big paper that caught a lot of news beginning of this year, end of last year, that unfortunately was retracted. This is the Elsner paper linking dementia and PM 2.5 wildfire smoke. And what they for 1 microgram, they were saying there was an increase of 18%. Well, unfortunately, those results became non-significant when they corrected the coding errors for mixing with Parkinson's disease. But the linear trend was there. And there was a significant paper from 2023 which showed dementia increased PM 2.5 from 8 of the 9 sources they looked at. The PM 2.5 was significant, and agriculture and wildfire, when controlling for the other sources, were the most robust associated with increased dementia. There's also been some studies suggesting brain tumors association with wildfire smoke. We know that lung cancer is a significant increase. And this brings us also to think about the workers, the people who are fighting wildfires. Unfortunately, policy today does not force the supporting wearing masks during wildfire fighting. And this could be a major effect on health. We see other associations with breathing the other toxicants besides the PM2.5 as well, when these are burning sources from your human structures and so forth. And when we look at air pollution in general, of course, there are many other diseases which you may be hearing about in the other talks. We know as well about neurodegenerative and neurodevelopmental causes, but lung disease, asthma, chronic lung disease, cancers. There was a paper that associated meningiomas with PM2.5. It's one study and needs more research. Birth outcomes and so forth. I'm going to switch now and start talking about the climate change effects from extreme heat, of which there are multiple that relate to neurology. 2024 and 2025 have been unprecedented in heat events. And so just like the increases in global temperature, we're seeing extreme heat events, which are causing human fatalities and human health compromise. In the summer of 2022, 60,000 or more excess deaths in Europe. And they were not prepared. They don't have the infrastructure, and they did not have the strategies in place to manage and prevent human life loss when this happened. And they've continued to have extreme heat, but they're losing less people by these excess deaths because they are now adapting and informing people on how to reduce the risk. But vulnerable populations suffer more. And these are, for example, people in urban centers where the infrastructure absorbs heat and there's not good tree cover. They can have 10% higher temperatures than the ambient temperatures elsewhere. Outdoor workers suffer, and children and the elderly and other vulnerable populations suffer. It's estimated that excess deaths from extreme heat are about 2,300 in the United States. There's been a significant upswing since 2016, and worldwide, per 100,000 has risen 23% since the 1990s. And this is challenging too, because not all these deaths have a label of died from heat. All sorts of diseases are affected by increasing heat. And this is an emerging area of research. It's estimated that the cause of extreme of heat, or that heat-related deaths from stroke and heart will double by mid-century at current trajectories. When we look at stroke, it is being influenced by extreme heat. At least multiple papers that are recent are showing that association. 2.2 excess deaths, for example, from the Almad study from 2024 per 1,000 with extreme heat days in over 40 countries. And dementia is being affected. Think of the Gene Hackman story that some people may have heard from last year. He was demented and his caregiver died tragically, and then he died probably from the heat effects, or at least related to probably heat effects. So we see increased hospitalizations from when there are extreme heat periods. If the extreme heat period from this paper for Alzheimer's disease and related dementias, when the heat is at 99th percentile for 4 days, close to 2 per 1,000 increased hospitalizations. And in China, interestingly, they found that the risk of dementia-related deaths was the attributable fraction to the heat was higher for the night versus the day at 1.45% versus 1.1. And this might relate to those effects on sleep and sleep-related risk that Beth was talking about earlier. And it does beg that we should be considering and counseling the caregivers of people with dementia and memory challenges to make sure that they're hydrating, giving cooling strategies, and giving them information about cooling centers if necessary. Just to shift a little bit here, another climate effect is globally increased infections and neuro effects from increased infections. The classic one in the United States is Lyme's. The ticks are living more through milder winters and therefore propagating more, carrying more disease to their hosts. In the last 30 years, you can see on the right, the diagram of the increased incidence is 3 to 4 times what it was in the upper Midwest and Northeast. Malaria got a foothold in the United States in 2023. New cases were transmitted from people who had not traveled. It's a huge problem in Africa and other countries, as well as other mosquito-borne diseases, and those are increasing due to more favorable transmission from the mosquitoes multiplying more easily. There's been some papers which have shown associations of heat with multiple sclerosis and headache, and this is an emerging topic that needs more research. And there's a large literature on climate and behavioral health now that I don't have time to go into, but multiple papers on irritability, aggression, domestic violence, depression, increased suicidality, memory, attention and reaction times, and sleep changes are additive. There's also emerging literature on climate anxiety and literature on displacement effects, the breaking of the medical continuity, the access to medications and medical treatments. It can be profound, especially if the infrastructure is damaged, for example, by a major climate event. And we need to also remember that these climate exposures are a justice issue in the US and elsewhere. Climate injustice is the disproportionate effects on low-income communities and communities of color. And we're seeing that partially through the air pollution. For example, the proximity to major sources of air pollution, that these communities disproportionately live next to them based on race policies of racism and redlining. And they suffer as well because of those same policies and the economic circumstances. Added burdens of social and environmental determinants of health are all additive. So the U.S. People of color, the American Lung Association in the global report said 3.7% more often in a county with 3 failing grades on PM 2.5 and ozone indices. And the annual PM 2.5 exposure of US Blacks is 12% more than US whites. This is also played out for indigenous populations as well. And climate justice on a global scale is profound as well. The countries which have produced a net amount of carbon dioxide, which lasts hundreds of years in the environment, as Beth was describing, are much less from the global south, those countries that have historically not produced a lot of greenhouse gases. While they do have significant pollution burdens now, which are affecting their health, they are also suffering higher ischemic stroke, disability, and mortality rates. And so all of these are profound, and we need to consider policy on the global scale of how we're going to address these problems. I'm going to shift a little bit now. I know we're running on some time limitation here, so I may jump through these slides a little bit and give us some time for discussion. But we can do things on an individual level. And one of the ones I want to highlight is we're not saying that people have to become vegetarians or vegans, but there's clear evidence that beef is a major burden on the planet and on our health. The greenhouse gas effects from the methane from cows burping is 25 times more potent than carbon dioxide, and it lasts shorter. So it's a much more effective strategy to reduce methane emissions if you have a choice. So reducing beef use and trying to shift toward poultry or a plant-based protein in your diet is for our patients and ourselves is a significant benefit for the planet. Reducing food waste is also significant. And there are multiple ways that we can reduce personally our carbon footprint. One of them, we are privileged to be able to fly a lot, and we might want to think about our choices, especially avoiding first class or multiple stops, but also, do we need to take those all of the plane trips that we're taking, and consider other options for travel, for example. Electrify everything, of course, is going to be important, and going to clean energy will be important. And if we can join, vote, communicate, and support education and research in these areas, we will be making a major contribution. I'm going to jump through over this a little bit quickly, but I do a lot of talking on indoor air pollution and stoves. The data is coming out. The stoves are a major contributor to nitrogen dioxide, which causes major amounts of asthma association, as well as the other diseases that we've talked about that we associate with the outdoor air data, stroke, Parkinson's, and so forth. So going to electrification in the home could have a profound effect for our own exposure and our families. And we can also go to cleaner energy very rapidly by just talking to our energy providers. Some of us are lucky to be in states that have what are called CCAs, which are community choice aggregates, where they basically are organizing clean energy for their customers, and they intercede between the customers and the utilities. But most utilities, including Idaho Power, offer that you can flip a switch, basically just request for a few pennies more a month to go to block options or 100% option of what are called renewable energy certificates. So you don't have to get solar. You can have clean energy essentially by buying a chunk of clean energy from somewhere else. And that will offset what your utility is using. Like Idaho Power only has 15% wind, 5% solar. A lot's hydro, which is somewhat sustainable, but 30% is natural gas. Fortunately, they're off of coal. And you can move that up to almost 100% wind by doing the Clean Energy Your Way Flex program. So just check that out, or what your local utility, if you're not in Idaho. We have a lot of power as clinicians and people in health. And we just want to emphasize that we are grounded in science, we care about our patients, and our voices as physicians are highly respected. And so we can be very important voices in the climate dialogue and shift the dialogue away from partisan and blaming to bridge building and communicating. And I'm going to pass over to Beth now to talk a little bit more about this.
Yeah, and I'll keep it brief so that we can take some questions at the end. I just wanted to leave on a ray of hope and talk about what we can do together. And also, my goodness, there's so much to do in climate, right? And I'm sure every time you have one of these lectures, well, where do I get started? What can I do? And how do I do what I can do at the time I have and the interests I have? So, even if you identify one area to get involved in, that's awesome. We'll be talking about that in a few slides, what your options are. As Bret said, recognize that we do have a lot of credibility as health professionals. We're trusted messengers and communicate simply and often. Next slide. And I just wanted, this is just fresh from the Yale Climate Communication Program. It's very interesting to me because it talks about the polarization, but it also has some glimmers of hope. This is where registered voters are supporting climate-friendly policies, and it's a spectrum. Certainly, Democrats are very high. If you look at the blue dots on the right side of the screen, they're very high on climate policies. But even conservative Republicans, which are, you can see the red squares, like if you take that first one, providing federal funding to help farmers improve farming practices to protect and restore the soil so that it sequesters carbon, 77% of them were in favor of that. And I was on a lobbying team, and a volunteer lobbying team with Citizen Climate Lobby with my Tennessee senator. I led the team, and she ended up voting for the Growing Climate Solutions Act to do just that, to support farmers. So there is hope. It depends on how we frame our message. It depends on what we're trying to accomplish. But really, even conservative Republicans can be supportive of climate. Now, we still have other areas, obviously, that we have to work on, like transitioning the U.S. economy from fossil fuels to 100% clean energy by 2050. We only have 26% of conservative Republicans there. But I did want to show that there is some hope. Next slide. And it's also important to think about how we frame things. Many people, regardless of political party, are very concerned about affordability and cost of living these days, including Republicans and Democrats. And you can see that 2/3 of registered voters, including almost 50% of conservative Republicans, think global warming is affecting cost of living. Next slide. And I think, Brad, in the interest of time,
we're
we
going
could
to skip these.
probably just say that it's very expensive, right? Climate, and we're all paying for it one way or another. Next slide. And again, we'll give you these two slides. We'll keep going, but they're very expensive. So Americans trust their doctors as information sources. Even among conservative Republicans, your primary care doctor was way up there in terms of trust. And trust among doctors has actually gone up over the last few years, even while trust in institutions like CDC have gone down. Primary care can be extrapolated, right, in neurology to neurologists, because many of us are serving in that role, especially with our stroke and dementia patients. Next slide. So we have a really critical role to play. And some of the things, I'm not going to get to them all in the next minute or two, but these are just some of the things that we focus on: staying hopeful, being curious, communicating with others, focusing on health, talking about pollution rather than polar bears, emphasizing the impact on our kids, our family, future generations, economics, being open to innovative ideas like market strategies, carbon fee and dividend, and communicating. I've been grateful to be part of efforts within Braver Angels, which is a group trying to bridge divides, and Citizens Climate Lobby, which is an advocacy group on climate, to really develop workshops on how we can bridge divides, how we can work with legislators better. Certainly Kathy Hayhoe talks about a lot of this in her book, Saving Us. And there's a great website called Potential Energy that will also help you frame your message in a way that people will hear it. Next slide. So to conclude, we wanted to make sure you knew what NICHE was. NICHE is Neurologists Interested in Climate and Health. You see Bret up there, you see me up there. Also, our colleagues Larry Junk and Ali Saad are part of this. It's the fabulous foursome. We like to think of ourselves. You can grab that QR code. We were formed in 2023 after Larry and I published an editorial in a neurology journal. You can see that at the top there. It was climate change and air pollution. We should educate ourselves. We should get involved. We came up with all these talking points for ways we can get involved. And we've made a lot of progress with the AAN, American Academy of Neurology, over the last few years. And we're also presenting multiple grand rounds like here to different groups. And please join our contact list for our quarterly updates and invitations for quarterly meetings. You can go to this QR code and it will give you a roadmap of different things that you can do regardless of what your interests are. Whether you want to talk to your patients about getting induction stoves, or your trainees about climate programs they can get involved in, working with your healthcare system to reduce emissions, getting involved in your with your legislators. There's all sorts of different things you can do. Next slide. And one more time, the contact list for NICHE. You can scan the QR code, or it's just nichebrainhealth.com. Brett could put that in the chat. We have a quarterly newsletter, quarterly lead meetings. We have guest speakers. We had a wonderful speaker yesterday talking about child neurology and climate change. And next slide. More links. And I think that may be it, right, Brett?
Right. There's a links page here that's going to be very helpful for many of the things we've discussed in the slides. And you can also look at the slides themselves, and they have links on the slides. Thank you.
Thank you very much. And
great talk, guys. Right. Really appreciate the tour de force presentation. A couple of questions that I want to try to get through. First, from the audience, can you speak to studies that are showing cognitive impacts during heat and air quality events?
Not as much to air quality events, but there is some. And that data I can include in the links page. I'll attach it to the links page. Yes, there is some. It's not as robust a literature, but when you look at exposures over time, there is some literature from like the child literature that shows IQ associations and other things from large sources of pollution over time. I don't think there's as robust literature on specific individual events.
How about studies that have talked about the co-occurrence of extreme heat and smoke events? Is there evidence about sort of a magnifying effect, I think is the gist of the question, because we're seeing, that in Idaho, we have our smoke season where the heat is usually quite high and the air quality is quite poor. And the two of those together really scare me.
Right. I'm not aware of studies that have looked at both of those together, although if you look at each of them individually, they clearly have evidence for significant association. So by extrapolation, we could imagine those two are additive.
Beth, I wanted to ask you a little bit more about the autism and air pollution studies that you mentioned. Like I said, we have this smoke season every year where our AQI is bad for 1 to 2 months, seems to get worse year on year. Though last year we had a blissfully nice summer. what sort of things can we do in our own lives to reduce the risk to our kids? And I mean, how extreme is this risk? Like, how worried should we be about taking our newborns outside if they're born in the summer?
Oh my gosh. Yeah. I mean, it's a risk benefit ratio, right? I mean, you want to get outdoors and all. Um, at this point, I would say just the usual things that to be cautious when if there's a wildfire going on, and just try to reduce the risk there. I It's really hard. I think we need to figure out ways that we can mitigate risks when we do have these wildfires. And keep everybody safe. Do you have any thoughts, Brett, on how to
Yeah,
reduce risk? Why don't you give
sure.
it a shot?
Um, I think we don't have the absolute answers, of course, but when you look at the data, it does suggest that even in the sort of air quality index yellow range, that's considered unsafe for certain populations potentially. That might not be safe for pregnant mothers, for
Mm,
example, and thus one way that, I mean, it's an aggressive step, but if you're going to be exercising on yellow days as a pregnant mother, you might want to consider wearing one of those N95s with a one-way valve,
mm.
something like that. If you're going out in wildfire smoke that's going to push the air quality index higher than the yellow, I would strongly recommend that. And
Yeah, or
we just don't have
indoors.
the data to inform
Yeah.
that absolutely. The other thing that's very powerful is to know that indoor air is affected by outdoor air. So our houses are not perfectly sealed. And therefore, I strongly recommend air purifiers are relatively inexpensive, a few $100s a year. If you can get those, during wildfire season or when the air quality is poor in above yellow at least, I would be running those air purifiers 24/7 and just clearing the air indoors because we spend most of our time indoors. And so we have much more control over that.
Thanks, Brett. Yeah.
Yeah.
I know we're a little bit over, but if I could ask two other quick questions.
Yeah.
One is about the two diseases that I think we're seeing kind of the biggest rise in, Parkinson's and autism. Do you think this sort of meteoric rise of the cases of both of these diseases that we're seeing is related to increased surveillance and diagnosis, or is it really being fueled by climatic changes and environmental circumstances that are making them more apt to happen? Or is it a
Yeah.
combination somewhere in
Well,
between?
I'll just say we really don't know because it's probably both, but we really need more research. So if RFK Jr. is listening, go environment. We need to figure this out, and part of the emphasis needs to be on um, emissions. And if it's better to call it air pollution than climate change, so be it, right? But yes, I think this could be part of the answer, and certainly for Parkinson's as well. We know environmental is important. Do you want to add to that, Brett?
I totally agree. It's probably both, but we need more research,
Yeah.
definitely.
One last quick question. Does Niche submit public comments about policies, particularly with the rollback on federal air quality regulations and things like this? And if you're doing this, sort of how are you doing this as an organization ourselves that's trying to do some advocacy? How are you finding it's most effective to do this?
Yeah, we made a position to the EPA. It was the endangerment clause, and we also we put something in, and we also encouraged our uh, followers or whatever, people who subscribe to Niche to do the same. And I just want to say, you don't have to do it as part of your organization. Like if you're a little worried about advocating in connecting it with your institution. You don't have to do that. Like your medical center, you can do it. Honestly, you can do it through the medical consortium. You can do it through niche. There's a variety of groups you can advocate through, as opposed to through your institution. I think that's just important for people to hear, because sometimes they worry, I can't do anything without checking with my institution, but you can do things through other groups that you're affiliated with.
Yeah, I would underline that the Medical Society Consortium is an excellent, we have that on our advocacy page. They provide opportunities to join letters and to advocate. And also, some people through their organizations are given information on how they can speak on these events. But yes, definitely I would consider joining other organizations which are giving you those opportunities. And we have lots of those links on the advocacy page.
Great. Well, thank you so much for a really wide-ranging discussion. Appreciate your expertise and your work in this space. We'll keep fighting the good fight together, and all of our neurologists in Idaho should join Niche. And thank you so much for your time today. We'll see everyone back at the beginning of March with Dr. Matt Burgess to talk about finances and climate change. Thank you all.
Thank you very much.
Excellent. Take care. Bye-bye.